Dr. Narendra Trivedi, Senior Consultant Urologist at KIMS Hospitals, associated with the hospital from the beginning since 2004. Today I will be talking about use of lasers in urology. Holmium laser has got two most important uses in urology in the treatment of stones and also in the treatment of prostate enlargement. Regarding the stones, they are treated with flexible ureteroscopy with laser as an energy source for breaking the stones. This is one of the recent advances in the field of urology, bringing lot of convenience to the patient in the form of early recovery and easy management of renal, upper ureteric and also lower ureteric stones. In the treatment of prostate, this is the best treatment available as of now along with TURP. The advantages of laser treatment for the prostate are that it can be done, extended indications it has, and also it is considered as the gold standard in large volume glands where otherwise open surgery would have been necessary. The treatment for laser in prostate surgery is called as HOLEP, H-O-L-E-P, or Holmium laser enucleation of prostate. When we talk about enucleation, it gives a much better clearance of prostate gland and much better recovery and faster recovery as compared to other methods. Stones in the urinary system, when we talk about the urinary system, it starts from the kidney, the tube which comes down from the kidney, which is called as the ureter, and it enters the bladder. So, kidney, ureter and bladder, and finally the urethra, the passage from where the urine comes out, all these constitute the urinary system. The stone can form in any part of the urinary system, that is the kidney, ureter, bladder, and sometimes from the bladder the stone gets ejected into the urethra and it may get stuck. So, stone can be in any of these locations. The treatment by laser can be done in all the locations. The treatment will be done in different procedures in all the location, and the stone treatment will depend upon the size of the stone and its location. These are the factors which determine the treatment method. The treatment method for kidney stone will be different, and there are multiple choices available regarding the treatment, and the best method will be decided upon the location and the size of the stone. So, as far as the kidney is concerned, we have few different methods for the treatment. The laser is used when we are doing a mini percutaneous nephrolithotomy or mini PCNL, where the blasting method is preferred by laser. The other methods will be the standard PCNL, sometimes open surgery when the stone is very big. As far as the stones in the tube, that is I described the ureter, if there are stones in the upper ureter or middle ureter or even lower ureter, laser is nowadays the preferred method of treatment, especially in the upper ureter, where the stone is likely to migrate into the kidney because the upper system is dilated and the lower ureter is normal. So, there is a dilatation, that means there is a swelling beyond the level of the stone, upper to the stone, and below the stone the ureter would be normal. Once the stone migrates into the kidney, laser turns out to be the best, because with the help of flexible ureteroscope we can reach not only the upper ureter but also inside the kidney, where otherwise other methods of treatment would be required. Regarding the stones in the bladder, usually the ones which are little bit more in size, the laser again becomes the preferable method, so that it can be blasted into smaller fragments and retrieved from the bladder. Otherwise, it would require open surgery where the stone size is larger. Regarding the prostate, coming to the prostate, the holmium laser enucleation would be the better method for the treatment of prostate in patients who are on anticoagulants and the dose cannot be adjusted, and especially in patients who are having a large volume of gland, more than 70 to 80 cc volume, where a complete enucleation will be possible, and having better results, and also the blood loss is very less as compared to the TURP, that is the transurethral resection of prostate. So, these are the major advantages which we find as far as the laser is concerned. Also, because the amount of bleeding is very less, therefore, it turns out to be a big advantage where the glands are vascular. The other uses which are uncommon as far as laser is concerned is in the treatment of stricture of the urethra, where a similar result can be had in comparison with the optical urethrotomy in cutting of small strictures in the urethra. The other uncommon use of laser in urology is with respect to small bladder tumors, where it can be used for resection and sometimes of evaporation for the treatment.